So if it appears that a patient has been triaged for cauda equina, there's radiological evidence to suggest that that's what they have, the positive bladder scan, then they would go on to a pathway for decompression. They would go on to rapid decompression of the cord.
Yeah.
If they had no new developing symptoms, so it was a radicular problem rather than a cauda equina problem, then they'd be put on a less urgent pathway for a decompression surgery.
Yeah. And I noticed too, people will see this more clearly when they get the documents, the handouts after the show, but having gone into secondary care, it is possible to go through the evaluation there and then find your way back into the MSK system again, isn't it?
Yes.
If all those signs of all those tests.
Or it's possible the patient may come back to you the next week and say, you know, I've had all my tests and investigations and I was given the all clear. So, you know, all options are on the table.
Yeah, interesting that. I mean, have you ever been in a position of thinking, well, I don't care what the tests and investigations say, I'm still worried about this and I'm not going to treat you?
I like to see the radiologist report. I don't feel confident with a patient coming back to me and saying, I've been to the hospital and they told me everything was fine. If I strongly suspect cauda equina syndrome, I'd like to see a bladder scan and an MRI report that convinces me that that's not the case.
Yeah, I mean, patients commonly would let us have their radiology reports after they've been in for whatever the investigation is. I don't think I've ever seen a patient bring in a bladder scan report.
No, but they'll often leave the hospital with a discharge letter, which will have whatever investigations and tests they've had will be annotated, and they would annotate that there was a bladder scan with a negative finding.
Yeah. So in terms of safety and practice, from our point of view, it's quite sensible to ask for that discharge letter, which is perhaps something people don't often do or don't routinely do.
So if your patient is coming back to you for a follow-up post-referral for query cauda equina, it's always worth saying to them, can you bring any documentation from the hospital, particularly your discharge letter?